Hi, everybody. Welcome to Henrietta's Hormones. It's lovely to see you. And I wouldn't want to disappoint you and not do my little Scottish thing. So today I'm going to talk about a wee man from the Isle of Skye. So I'm just going to say the first verse. So I just come down from the Isle of Skye. I'm no very big and I'm awfully shy. The lassies laugh as I go by and say, Donald, where's your trousers? So they've got a wee bit of misinformation going on. They think that men wear kilts and that's all they wear. Well, they don't. They have trousers. And so this leads us into the subject of functional medicine, bioidentical hormones. That's like your body's own system, and also the validity of it all and the quality of it all. And we are really focused on good standard of care, things that are measured. So my guest tonight is Chris Cox, and I'll let him introduce himself.
Well, thanks. I speak English as my first language, but I feel like I didn't quite understand your Scottish lyric. But I did. You did clarify for all of us and
Yes.
the listeners that it is about misinformation.
Yeah.
But yes, thank you. My name is Chris Cox. I am a pharmacist at Smith Rexall Drug. There's 3 stores now. There's one in Pleasant Grove and Lehigh, and one new one in Pleasant Grove that does sterile compounding. So we're a compounding pharmacy, which hails to our roots of pharmacy, apothecary. So that's kind of that's our passion as chemists, and really seeing if we can create therapies that are customized for the patient and with their unique, symptoms or underlying disease state. Let's get to the root and let's see if we can treat it. And certainly we talk about this all the time, and I know you know this, Esme, though, it's this triad and this collaborative effort between you, the prescriber, the practitioner, myself, the pharmacist, and then the patient, of course.
Right.
So that is what I try to do, and love collaborating with practitioners that really are not just band-aids and not only spewing misinformation, but also that's sometimes their only source is misinformation. So you almost doing the patient a disservice by just band-aiding all of these symptoms when there's something at the bottom of the true cause, and then that's what you're trying to fix, and then I'm a small part of that.
Yes. Well, some of the things that we use for Chris to make for us is definitely, it's a women's clinic. We don't have anything against men, and they need just as balanced as women do. And so the identity is, and this is where I try to make it really simple, is I hold a bottle of water in one hand and a bottle of Coke in the other. And I say, which is the altered beverage? And from that, we lead the discussion into what exactly a bioidentical hormone is. Could you explain what that is?
Yeah, I love this thought of hormone replacement and bioidentical. Before I answer that, though, I love that you said that this is a women's clinic, but men, you still love men, and you're okay. We're just. I think what you're trying to say. We're a lot simpler to fix. We've got one hormone.
Yes.
Certainly there's others, but we're pretty much one button to fix, and if we mash that button in the hormone world, we can fix it all. And on your side, the complexity of women and the many hormones that they touch. And I think that's probably as a great lead in, because hormones, there's so many phytoestrogens and false hormones that are environmentally hitting those buttons and just wreaking havoc in the women's cascade of hormones. So what a bioidentical hormone is for us is, if you were to take so some of the products and the preparations that we make for females, we have to find a source of hormone, an estrogen, a progesterone, a testosterone, a DHEA, whatever, the hormone. And what we need to be using a hormone that if we were to compare it under a microscope and pull out the blood or the hormone from a female, and then you can compare them, look at them under a microscope, they would have to be identical. And I think sometimes bioidentical gets just thrown around, but I think it's really, from a hormone standpoint, from a molecular structure, they have to be identical. And even something so small as a carbon group between the two can cause significant changes. I mean, if you look at even the difference between testosterone and estrogen, it's only just one it's just one little carbon group that
Yes.
makes the difference. And I mean, speaking of misinformation, though, I think that's why in the early 2000s, hormones got a bad rap because the Women's Health Initiative, they were using words like bioidentical,
Yeah.
but really they were not using bioidentical hormones. They were using Premarin or Provera, which were these are synthetic hormones that they play on the same receptors of hormones, but they downstream cause all of these side effects, increased, breast cancer risks, some clotting risks and issues that eventually caused the trial to just end because it was harmful. But it was because they were not using bioidentical. So what we do, just to wrap up this whole thing as far as misinformation and bioidentical, is we use hormones that are bioidentical, and not only they're identical in shape, but it's also important finding the right method or the right route for getting him into the patient, right? So whether
Yeah.
that's a cream or a troche or vaginal application but there's so many different routes that we have access to it, but also how refined it is. We had to find sources that have incredibly refined, there's clumps, I mean, I'm not using technical words, but like the clumpiness of the progesterone, we find the smallest micronized progesterone, as an example, that when it's presented to the patient, it's either the gut or topically or sublingually, or under the tongue, it'll be easily passed into the bloodstream, and you can see these biological results through the vehicles and the product. So from the product to the vehicle, all of it's packaged up in this nice system that can be delivered to the patient efficiently, consistently, and accurately.
Would you talk about some of the science behind it and maybe a little bit about the manufacturing company, PCCA? And we've been to a lot of conferences, and the teachers there know the pathophysiology of a human being like a grocery list. Like they just rattle it off. You've no idea how magnificent and how intelligent they are. And I think part of it is I wouldn't be here touting bioidentical hormones if I wasn't someone 17 years ago did get breast cancer that went into my lymph because of the non-bioidentical hormones.
Yeah, so there's a lot of on the pharmacy side, on the compounding pharmacy side, there's a lot of players that help us do the right job for the patient. So you mentioned PCC is a company. It's oversimplified to call them a wholesaler of drugs. They do so much beyond that. They're advocates for our entire profession. They're on Capitol Hill fighting for our rights. They're screening all of the chemicals that come through so they get the highest quality possible. And then, so that means when we buy these bulk raw powders from them, we know that we're getting an incredibly quality product that's been vetted. But not only that, but they help us with formulations so that each patient in the hormone world, because there's usually for a female patient, we might be dealing with 8 hormones. So it's not only knowing that we're getting the right hormone combination, but we're also using the right base. Some bases are great for topical. If it's a male, we might, and they're using more testosterone, we'll use a different base. So our female patients will pick a different base. If it's vaginal or sublingual, we have bases that will increase the contact time under the tongue. And sometimes it just beyond hormones, we have ENT patients that we have to use these innovative bases that deliver medicine over 24 to 48 hours. So it's these vehicles that have, whether you're using, sometimes you need a pickup truck for the job, and sometimes you need a Maserati because sometimes we want it to absorb. Other times we just want it to sit elegantly on the face and just help us with our wrinkles and our anti-aging.
Right.
So we'll use a different base that's more refined, that has more of an elegant feel, but that also moisturizes. So you can see once you start going down this rabbit hole, there is a lot of bases and a lot of vehicles and
You
a lot
have
of
to know
hormones.
what you're doing.
You have to know, depending on it's not only the acidic environment of wherever you're putting it or the pH balance, the size of what you're trying to push through to get it through into the bloodstream. There's a lot of factors that go into making sure that we can create the right product for the patient. And so what people sometimes get nervous about is for compounds and compounded preparations is this idea that it's not an FDA approved drug, that it hasn't been vetted by the FDA. And I think it's it's a misinformation, it's a misbranded word, because everything that we use, all the active ingredients, all the powders, all of that are components of FDA approved medications. We're not just going willy-nilly to the black market and finding drugs that have no research or have not been through clinical trials. We're actually using FDA improved ingredients. But the caveat to that is we're usually using them in a way that is not a normal approved FDA route, meaning this estradiol or estrace, as an example.
Yes.
There is an estrace cream and there's estrace oral, but when these big pharma companies apply for an FDA patent and license on a certain drug, it's very specific to the concentration, the strength, the route, the delivery, and so it's so specific that it almost, if they go a few milligrams below or above that strength, even though it would benefit the patient, now it's off-label use. So what essentially, in my top 200 dispensed medications, the majority of them are used off-label. They were brought to market and then ended up going and helping patients in another way that the manufacturer never intended, and now we're using them off-label, right? So that's exactly what compounders are doing. We're using really solid science to create off-label uses of traditional medication. So I think that just needs to be underlined and underscored with an exclamation point. Is what we're doing is founded in hard science, and we're just slightly taking the knob and we're tweaking it a teeny bit to the left or to the right for a patient who's experiencing some symptoms or some conditions that fall outside of that manufactured FDA medication. So that's kind of our sweet spot. But everything is not just cooking up a new something that hasn't been studied. I mean, obviously, just like you, our first oath, hypocritical oath, is do no harm. And certainly there's many times when the products come or we get a patient and wants to try something, and maybe the dose we're uncomfortable with. That's when we're going to call Esme and say, Esme, this seems unusual. And we're gonna have a conversation to see.
He does, and it's a good conversation.
It's a collaboration.
As you were talking, a lot of people don't know that we actually don't also willy-nilly decide what people want. I've had a few people say, well, tell me how you come to these decisions. And how we decide is through testing. Not just testing though, we have to know their history. We have to know what they're dealing with. We have to know their symptoms. We have to know what's happened in the past. And honestly, it's not really a 10-minute visit. You have to kind of know what's going on in order to know what to order, but then you have to go a step further and do the testing and see whether they're deficient. So to me, it's very refined. It's very carefully supported by what Chris said. It is substances that is approved. And I'll tell you, there's stuff out there that the FDA has approved, and I've wondered, why. But I had a question for you. In fact, I had this conversation today with an elderly gentleman, and we were talking about the benefits of hormones. And he said that he gets seeds injected. And I think what he meant was pellets. And I sure would like your opinion on the pellets, because I get asked this all the time, and I have my reasons why I don't do it, but I'd love your opinion.
And I think the place for pellets, if there is one, would be in men, where it has a large therapeutic window for testosterone. You can drive it. I think there's some risks with the pellets. One is, once you place and insert a pellet, they're stuck with that dose for 2 to 3 months. So you just and everybody metabolizes a little different. So you lose, as a practitioner, you lose control of downstream what that's going to do. Not only overdosing somebody, like, oh, that's not too big of a deal, but I think it's what conversion happens, what happens to their hematocrit, what happens to their estrogen levels. There's conversions as you elevate one hormone too high. The red blood cells is an issue. But that being aside, let's say you started conservative. The other potential issue is, it's a sterility question for me. These pellets are autoclaved, or they're heat treated, but there's no way to guarantee pure sterility, is the concern. And so there's you have abscesses, or you're injecting something that's not, and maybe it's only a small percentage of the time where it's not sterile. So maybe 95% of the time it's fine, but then you just have those 5% where the complication is pretty nasty. That's my concern with pellets. You have to dose things and do the right routes, and it's incredibly difficult to have a zero risk for anything. But with pellets, I think there's just a higher risk that you're just going to have to ask yourself if the risk is worth it. And I think and there's many patients out there that have phenomenal results on pellets, but there's a lot of things that can go wrong, and when they go wrong, you're stuck with them for a few months.
Right. It's funny that you should mention that, Chris. Actually, one of the gentlemen that did come here was someone I knew, and he actually got a huge infection, and he had to go to the hospital 4 times a day to get IV antibiotics. So it really does happen. And I also believe, too, that, in some cases that doesn't happen, but there's a greater risk than keeping it from being injected, that invasive way of getting into the system is good practice. And as he was talking, I was thinking, I'd be scared to kind of measure things, once you got a huge dose, just exactly where it would go. So I would like you also to talk a little bit about the GLP-1s. Like I mentioned it last week that I was going to bring it up. And some people go, well, what's GLP-1s? And if I use a common advertisement words, it's like Mounjaro or semaglutide. And if you could just talk a little bit about the composition and how it does benefit, because I've had a lot of misinformation out there that people are cheating, but once you're on it, you're going to be on it forever. And it's really getting some discord that it doesn't deserve.
Yeah, sure. GLP-1s have been studied for, the ones that everybody's familiar with is Ozempic and Mounjaro. But there's others out there. Victoza was another one, which has been out and has gone generic. And primarily it's been well studied. So I think one of maybe the questions that people ask is the risks and the side effects. And some I think we know, some that have been pretty well established. There's some that were like, I don't know. Because it's become so popular, I think we'll see downstream if there's anything out there. But Victoza has been out for we're looking at 15, 20 years.
Oh, I didn't know that.
Yeah, well established in a diabetic culture or a diabetic subset. That's typically the indication. And there was practitioners that I was aware of that were using Victoza for weight loss. So it's not unheard of, but it does phenomenal work for patients with their A1C.
Yeah.
I mean, these diabetic patients, these are life-changing medications. Now, but I think maybe more your question is you have patients that come in that are obese or overweight but that are not diabetic. And I'd almost say that they're definitely on their way to being diabetics.
Yes,
The longer they're overweight,
Yeah.
the risk factors just go up
Yeah.
significantly.
Yeah.
And if you look at the American diet, it is incredibly it's not doing you any favors.
No, not anything.
And so I had this conversation with some friends about whether we should be using GLP-1s for weight loss. And some of their arguments, well, I thought were okay. I mean, because primarily the two mechanisms that Mounjaro and Ozempic, GLP-1s, they shrink your appetite, so you feel. I describe it as just quieting the food noise, and then the second thing it does is it slows your gastric emptying, so you feel full sooner, and you feel full longer. So those two mechanisms, I think, make for a incredibly useful tool for helping you change your lifestyles. I think there's a lot of clinics that might not be doing it, or not, or maybe just speaking of those 5 to 10 minute visits where
Right.
practitioner,
It happens.
where they're just going,
Yeah.
and then you have somebody that probably shouldn't be on it. I think you can be unhealthy at the right weight, even if it's the weight in your head that you think that you need to reach. You can
Yes.
be just as unhealthy at that weight as you are overweight.
That's an excellent point.
Right. So I think GLP-1s combined with a practitioner that's taking the time to balance your complete functional integrative life, looking at the patient as a whole. So you're being balanced hormonally, your adrenals, your thyroid, your gut, your heavy metals, all of that's being assessed and looked at. And then, but also at the same time, you have the patients just wanting to get to a better, healthier weight. And I think in those patients, and doing it paired with the right practitioner, I think have phenomenal results, and there should be no guilt. What you're really trying to create is that groove and that habit of lifestyle changes, and you just need something that can help you get there. And what's interesting about GLP-1s, so if you increase the dose, you can your appetite, you can control a lot of things. And you'll see like clear results of your appetite suppression and your gastric emptying. But if you even maybe this answers your question about long term. I think you're seeing some fascinating studies about just reducing general inflammation in a patient by microdosing. So what would the harm be of doing something long term? And I don't know what that long term. I guess that's a patient individual question.
Yes.
But I think there's some interesting studies because there's so many patients on it. We're going to have some interesting studies that is going to look at everything beyond weight loss. I mean, you're looking at the type 3 diabetes, which is dementia and Alzheimer. And what is that going to look like with these GLP-1s? Can you reduce the risk of dementia, Alzheimer's with GLP-1s? That's being studied. What about just general inflammation of GLP-1s? Microdosing, meaning you're taking these sub-therapeutic dosing. And so that's something that compounders are good at and creating. So we're looking at GLP-1s. We're adding, glycine, which helps patients lose fat in the right place and maintain muscle in the right place. So we're doing glycine. There's B12. There's other things that you can add to your, but I think what's more important about a compounded versions of GLP-1s is the flexibility of creating the right dose for the patient that's not stuck in the traditional 5 milligrams, 7.5, 10 milligrams, whatever. You can really play with these doses, and microdosing sounds very interesting. But there's so much information that's going to be coming down the pipeline still. But from a safety standpoint, the difference between Victoza is a daily injection, and then you have the Zero and Ozempic that are weekly dosing. But even coming down the pipeline, there's these other GLP-1s that are going to be monthly dosing. There's some innovation in the GLP-1 world that is just going to keep popping up. There's so much information. This drug seems pretty much a game changer and on a lot of aspects. But just to recap the whole thing, GLP-1s used appropriately with lifestyle changes, I think is a game changer and really can, because you think about a patient that you're trying to balance hormonally, but they're in the obese category. That is an incredibly challenging patient. But if you can help them dial back their weight to a healthy weight, their hormones change, but their hormonal needs change. You seem,
Oh, yeah.
so anyway.
Definitely have to adjust. As Chris was talking, I was thinking about the microdosing that I'm doing. And one of the patients that I have is actually an active cancer right now, kind of a rare cancer. And the oncologist was over the moon that she's doing this. And she told me how much her inflammatory mediators have gone down, even although she has active cancer. Me, myself, and I love to do little tests. I love to see where the insulin is as well. That's a great challenge for women. And, hormones sit in the tissues. And sometimes we don't always get a very accurate one, especially, as you say, when they are heavier. But to even, like, when I first heard about diabetes 3, I wanted to cry, because I just think that's a preventative thing. And to think that people go through what they go through and their lives are miserable makes me so sad. There's other fun stuff coming up, and I don't know if you're into the new peptide injections that are coming out, and people are studying that all over the place. And I'm hoping that down the road, Chris, that you'll come back and chat.
Yeah, without question.
Yes,
The second one.
yes. Well, I have at least a list of 20 people that need the peptides. I just think from the journey that I've had, I kind of opened the doors and I said, I don't want any woman to go through what I went through. And I honestly, as I said on the last podcast, just threw it together with pennies. And I had a lot of support from many, many people. And I haven't closed the doors yet. And this is the first time I've ever done any real advertising, is to get on a video podcast and just kind of let people know that this medicine is serious. This medicine is real. It's beneficial. It makes a difference to your life. It makes you feel better. And if you have someone that's watching you carefully, all I can see is nothing but success. And look at the team we have right here. He has a whole team. He has 3 wonderful offices. One of them is sterile. So he does know about the peptides and GLP-1s. It's so exciting. And I'd like to wish you all a good night or a good afternoon from Henrietta's Hormones. Thank you. Bye.